office are, seem to be happy, they're working, they just have a meeting, and then the next thing you know, they jump off a building. So is there anything you want to say to employers, people who run the company, the HR, to look out for it? We don't want people to, you land on the ground and people suddenly think I should have done. So what is that I should have done for the employers?
Well, let's go back to, in the beginning part of the signs, right? Because an acute situation may happen one day where maybe a loss of a family member, maybe fear of being imprisoned because of something had done wrong, loss of face, for example, right? Embarrassment, that something happens and it's really quick and the person reacts. On the other hand, there are those cases that people are dealing with suicide ideation and depression for a long period of time, and then there's a change within the behavior. A person may become more quiet, they may take more sick leave, they may their work may start to decline. And if an employer is able to provide care or know enough about the people, but in large organizations that's really different, right? So it's a matter of, I think, of having companies sensitized to the reality of potential suicide and depression, and being in the workplace to be assertive enough and create networks and mechanisms to begin to talk about it so people can be attuned to other people in the environment. Right?
Yeah, that's great. I just want to add something for whoever's going to use the material. Like for all the places that I've worked at and my friends, and we often find one of the two major reasons why there's no mechanism in a lot of places. One is funding, right? Because funding is, marketing has a lot of funding, programs have a lot of funding, but when it comes to well-being, there is a minimum because it's really costly. So funding is one thing. I think the second thing is training. You have HR, yes, they're trained in laws and in internal regulations, but most of the time they are not really that aware of the mental health conditions of people, how to tell the signs and stuff, right?